Hi, is it Mr. Gorman?
Yeah, that's right, yeah.
Hi, Mr. Gorman. My name's Lasith. I'm one of the doctors. I understand that you wanted to speak to me about an incident that's happened.
I'm going to be honest with you, I am not pleased at all with what it is. I heard some of the staff around the station on the ward talking about me, which is really, really unprofessional. First of all, you shouldn't be discussing patients, and not only that, but when I was listening in, they were talking about, he's in, think he's got a stroke. There's nothing wrong. He's just got dangling his arm and all that stuff. I mean, that. One of them said, "What will he be doing next?" Slurring his speech, and all having a good laugh. And they were playing flipping hangman at the time as well on the station. We're supposed to be busy and we're supposed to be professional, and that is not good enough. Now, listen, I work for the NHS on a stroke unit, right, at another hospital near to this one. If my staff got heard talking like that, there'd be big trouble.
Of course.
Straight in front of HR, there'd be for saying things like that. I mean, what kind of example is that to give other patients as well? It just sounded like, this guy's a joke, and what he says is not true. He's not sick. He's just codding. He's having people on, that kind of thing. It's just rubbish, all of it. It's not good enough.
Of course. I totally appreciate your frustration, and please do let me apologise on behalf of the department that this happened, because it absolutely shouldn't have happened.
Has it happened before?
Not that I'm aware of, but
nobody said anything.
It shouldn't have happened on this occasion. And what I can.
There's one that was particularly gobby.
Sure. Okay.
And has just got no right to say that kind of stuff at all. I still believe that I've got quite a serious condition, and I don't think people are listening. Now, I've heard that from patients for years.
Yeah, of course.
You're just not listening, you're not engaging with me. I am poorly and you're not doing anything about it. And I find it happening to an NHS staff. I mean, we're supposed to be like, well, I wouldn't say a family, but we're supposed to all work together, aren't we?
Of course. And I'm really sorry that this has happened. And what I can say is, from my perspective, I can make sure I speak to the staff involved, find out a little bit more about what happened, and escalate it accordingly to the nurse in charge and the consultant if need be. And of course, you're well within your right to speak to the patient advice and liaison service and put in a complaint if you'd like to as well.
Tons is rubbish, though, isn't it?
It's up to you. It's a service that's available if need be. So that's.
If I start complaining as well about NHS staff, that's going to go on my record, isn't it?
So I don't know exactly how they deal with complaints, but it shouldn't stop you from.
Or am I an NHS?
You're very much a patient to us at the moment. So our job, as with any patient, is to get you better, and certainly this type of discourse that you heard today is not helpful. I agree with you on that, and we will investigate it accordingly and make sure we do our best to make sure it doesn't happen again.
I believe you.
Yeah.
But I don't believe the systems that you have here.
Sure.
I don't have any faith in them whatsoever.
Sure.
And again, I'm not thinking about me. I'm thinking about your patients.
Of course.
They hear that stuff.
Yeah.
We've got such a bad reputation at the moment, which is so unfair.
Yeah.
And then you've got people behaving like that. No wonder we have a bad reputation.
No, you're right. So certainly that type of incident doesn't help with public opinion. It doesn't help patients get better, and it certainly should be investigated and addressed.
So especially I want her sorting out.
So don't worry, we will look into that. I just also wanted to have a chat with you about the actual diagnosis and whether there's anything you needed clarification on, essentially.
Yeah, well, obviously because I work on a stroke unit.
Of course, you're very familiar with it.
I'm very with the symptoms, and I was desperately worried that that's what
understandably I
was undergoing, and I'm still finding it a little bit difficult to communicate. So what's up here to here is not working well. My brother had a stroke.
Right.
And,
sorry to hear
that. He's in his early 40s. He shouldn't be having a stroke, and that's what I'm seeing all the time.
Understandable. Yeah.
People getting younger and younger.
Sure.
We sort of speculate, is it to do with stress and things like that?
Sure.
And I do work a lot of hours.
Absolutely, it's a stressful job. Yeah.
Again, the feedback I got was, it's just stress. What, just stress?
Yeah. So I agree. So that's not a particularly helpful way of framing it. So what I will say, some positives to take away from the investigations you've undergone is that the CT head scan and the MRI scans you've had have been negative. So there aren't any physical changes there to explain the symptoms. And that's actually a really good thing, because it suggests that you haven't had a big stroke, and it's something that we can address in other ways.
We know you can have mini strokes.
Sure.
And you can go on in life without even knowing you've had 30 of them. And
sure.
I just want to make clear that that's not what's happening. It could be a propensity in the family, couldn't it? Really, if my brother's had one.
Yeah, that's a completely fair point to raise. So we can only base things on the best investigations that we've conducted so far, especially CT heads and MRI scans are helpful, and it's useful to know that your brain actually looks like it's in very good shape. There's nothing to suggest you've had a stroke. That being said, we still need an explanation for your symptoms, because it's clearly affecting your day-to-day life and your ability to work.
Yeah.
So you mentioned stress, and I wasn't sure if you'd heard the term a functional disorder before as well. If that's
disorder.
A functional neurological condition, basically. Is that something you've heard of before?
Condition's better.
Yeah. Sorry, there's just certain ways in which we word things.
Yeah.
So what we mean by functional, I mean, sometimes people misconstrue there not being a physical cause with there not being any cause whatsoever, and that patients are making things up. But that's not how we should approach such situations.
That's not me. I wouldn't waste people's time.
Not at all. Exactly. I mean, you've got plenty of years working on stroke wards. You know what you're talking about. So essentially, what functional disorders mean is that instead of there being a physical cause for your very, very real symptoms, it's actually coming from more a psychological distress, which you mentioned earlier. You said you've been under quite a lot of stress recently.
Yeah, but that again sounds like I'm just making it up. It's all in my head.
That's not quite the angle I'm taking. So, for example, our brain and our bodies are quite inextricably linked. The same way you watch a horror film, your heart starts racing. You see something unpleasant, you feel a bit nauseous. There's lots of ways in which your mind can process something, and then your body physically manifests something else. So that's how I'd explain functional disorders. It's not saying that your symptoms aren't real by any means, or that you're putting it on, not by any stretch of the imagination. All it's saying is that there isn't a physical cause, and hence we need to probe a bit further to figure out if there's anything else, lifestyle factor-wise, in terms of stresses that may have brought this on, and you already sort of alluded to that yourself.
Well, all right, talking professional to professional, I still think people look down. It's almost, you haven't used the words mental health, and I think that's really good.
Yeah.
But there's still a stigma around,
of course,
seeking counselling and stuff like that. So what would you do in this position?
Sure. So I certainly think that's an approach we need to take, is essentially trying to address the psychological stresses. And I appreciate there has been stigma around mental health in the past, but it's something that is actually getting better and better, and there's more robust services. Yeah, there's more robust services available now, and I appreciate, there can be long wait times, and there's certain things that are a bit out of our control.
Yeah.
But our priority right now, both yours and mine, is to get you better, get your arm better, get you back at work, and get you back doing everything you enjoy.
Which is what I want to do.
Exactly. And I think one approach is referring you to have some therapy, for example, and being evaluated from a mental health point of view. And it's not something that you should try and pin any stigma to, because it's something that affects a lot of people. And it's really important that we try and be pragmatic, the same way that if you broke a leg, you go and see the appropriate doctor about it. We need to treat these kinds of conditions the same way, with the same sort of pragmatism. Does that make sense so far?
It makes sense. It doesn't explain to me fully what's going on physically.
Yeah.
Because there is something going on physically, and I've learned from my career that people will tell you when there's something wrong.
Of course, yeah.
They know when there's something properly wrong.
For certain.
And I feel there is something.
For certain. And something I'd like to reiterate with the functional diagnosis is that it's certainly something we arrive upon once we've excluded everything else. So we do all these blood tests and MRIs and various things that you've had done over the last few days to make sure that we haven't missed something physical. And you've been through quite a rigorous panel of investigations, and we haven't found anything else to explain the symptoms.
I guess it's good, yeah.
Which is good, yeah, exactly. And now we have a plan in place to actually address the psychological stresses that may be precipitating this. So what I'm hoping is that once we get you referred, get you engaging with these services, you might find that everything actually starts to get better. So that's the plan that I would recommend.
Okay, but just keep me away from Gobby on that one.
I'll do my best.
Honestly.
Is that all right? Does that make sense so far?
I know that I can tell you're a good member of staff. There are good members of staff here, and it's just, you can't have people out that lane you down.
Of course, no, I understand.
It's not fair on the rest
I'm
of
sorry you had that experience, but at least we've clarified some things here. Is that all right?
Yeah.
Right,
Yeah.
thank you very much. Thank you.
This was clearly a very angry patient in the setting of an inappropriate situation where staff were overheard talking about him. An angry patient must be allowed to explain their anger, and listening empathetically is key, which was done very well here. Taking the patient's concerns seriously is key, and giving an explanation of what you are going to do about it is very important. Apologising for how this has made the patient feel is perfectly acceptable. Candidates need to be careful about apologising completely for certain situations, and sometimes these scenarios often need navigating carefully. In a lot of scenarios, the candidate is being given information about a situation that they have not been directly involved in, and it must be remembered there are always two sides to every story. The candidate may suggest that an investigation is needed to get to what has happened exactly and answer some of the difficult questions or accusations that are being raised. An offer of an internal investigation or a formal complaint to PALS may be appropriate. The explanation of a possible functional disorder was handled very well.